Hello, my name is Lori Hartnett. I'm Director of the Rehab Service Department here at Hutchinson Regional Medical Center. I'm in my 11th year here, and welcome to the Pre-Op Orthopedics class. We are glad that you have chosen to have your knee or hip done with our facility, and we are excited to help you start your recovery even before you have your surgery. You're getting ready to hear from a lot of professionals to talk about what to expect before surgery, after surgery, and then once you go home. We are going to have people from pre-op and surgery, nursing, physical therapy, the dietitian, respiratory therapy, and pharmacy all tell you what you can expect. We are so glad that you are here, and we look forward to helping you recover.
Hi, my name is Becky. I'm a nurse in the pre-admission screening office for surgery, otherwise known as PASS, and we will be the ones that call you a day or two before your surgery, probably 1 to 5 days before your surgery after you get scheduled. When we call, we will be going over your medication list, your allergy list, your health history, and we'll be going over your instructions. We'll tell you what time to be here, and then we will tell you, like, bring comfortable clothes. You'll want something for physical therapy, and loose or tennis shoes or walking shoes. Bring your insurance card and photo ID, and don't wear any makeup, fingernail polish, or jewelry. If you wear dentures, don't use any denture adhesive. If you have sleep apnea, bring your CPAP. So you'll want to take a bath or shower the night before and the morning of your surgery using a liquid antibacterial soap like Dial or Hibiclens, and doctor's office will give you a scrub to use on your knee or hip that you use the night before and the morning of also. You'll sleep on clean sheets and pajamas the night before. We don't want you using any lotions, any powders or anything like that the day of the surgery. If you take any blood thinners, any diet medications, anything like that, your doctor will tell you when to stop those. Any diet medications need to be stopped 2 weeks before. Your blood thinners are usually 5 to 7 days before. And we don't want you taking any herbal medications, so we'll have you stop those about 2 weeks before surgery. When you come in for your surgery, you'll go to the admissions office, and then they will check you in. They'll need your insurance card and photo ID, and then they'll have you have a seat. A nursing assistant will come out and get you. We have 3, that's Jeannie, Jan, and Veronica. So one of them will be the ones that come out and get you. They'll take you to the bathroom, change you into a gown, get your height and weight, take you back to one of the rooms and put you in the bed. They'll put TED hose on, blood pressure monitor, O2 sat, and heart monitor. Then the nurse will come in, and she's going to continue asking you more questions like we did on the phone with PASS. They'll start your IV. If you need something to help you relax, you'll get that after doctor has talked to you and anesthesia has talked to you. If you need a catheter, they'll put that in after you've had your block if they can. Anesthesia will put a block in, either a spinal and a femoral block of some kind for your surgery, and they'll do that in the block room. When you do the spinal, they'll have you set up on the edge of the bed and lean over on a pillow, and a nurse will be right there in front of you so you don't fall over off the bed. And then they'll do the spinal. It's really not that bad. The surgeon, Dr. Larimore Lowen or Severud, would have already marked the knee that they're going to do or the hip, so you'll have an X on that side, and an OR nurse will come and talk to you before you go back to surgery. And anesthesia will talk to you before they do anything as far as a spinal or a block. So if you don't do a spinal, they'll talk to you about that. If you need a spinal, they'll do that. If you can't do the spinal, they'll do a general anesthetic, and they'll explain all that to you when they talk to you. So once the anesthesia has done your block, they'll take you to the operating room. You will notice it's probably cold, so you can get warm blankets before you go, or in there they'll put warm blankets on you. Once they get you in there, there's lots of equipment in there. There's the striker, there is lots of parts for your knee, there's lots of tools that doctor uses during the procedure. More than likely you won't remember them because you're going to be sedated before you even get in there. But if you notice that stuff, that's just part of the surgery process. You will meet all the OR team. There will be Dr. Larimore, his assistant, his PA's usually in there, and then they have the guy who's running the robot if you're having the Mako procedure, he's in there, and the nurse is in there, and a scrub tech is in there with you. Once they get you on the bed and they get you all positioned, Dr. Larimore comes in and does the procedure. And anesthesia is always at the head of the bed watching over you. They make sure everything's safe. When the surgery's over, they clean up your knee, sew it up, or your hip, whichever one they're doing, and then they'll take you to the recovery room. And in the recovery room, again, it is cold. They can give you more warm blankets. They're going to be checking your vital signs. Try to keep your pain under control, nausea under control, and just make sure you're stable before they take you up to your room in the hospital.
My name is Brian Fleeman. I'm a certified registered nurse anesthetist, and I'm here to talk to you today about anesthesia options for total knee and total hip joint replacement. Two of the different things that we can provide you with is a general anesthetic and a spinal anesthetic. There's some differences between both of those, different risks and benefits with each. With the general anesthetic, we would give you some medicine through the IV. It gets you off to sleep, works fairly quickly, takes about 10 to 15 seconds after we start giving you the medicine. After you're completely asleep, we do put a breathing tube down your windpipe to protect your airway. Some of the benefits of that is you are completely out, you don't know or remember anything. You do have a little higher chance of having nausea and vomiting after surgery with that anesthetic, and also there's a little higher chance of having pain and needing pain medicine through the IV with that. The other option is doing what we call a spinal anesthetic, is where we clean off your back with some sterile solution. We inject a little bit of local anesthesia to numb up your back. After you're numbed, we use a very, very small needle to insert it into the correct space, inject a little medicine in there, and basically numb you from the waist down. We still give you some sedation medicine so that you're not completely awake, but you're not completely out either, so there's some things you can remember with that. Some of the benefits with the spinal anesthetic, though, is it eliminates all your pain. You have very little pain right after surgery, and it actually reduces the amount of pain medicine you have to take even several hours after surgery is already done. There's also less bleeding with surgery with spinal anesthetic, and that's what most of the surgeons prefer. It is a choice between you and the anesthesia provider, and they'll be happy to talk to you at the day of your surgery which option is best for you depending on what medications you're on and everything else. So feel free to ask them any questions about what the differences are between the two. Most of the time, I would say probably 85% of the time we do a spinal anesthetic because it's preferred by the surgeon. And there's a lot of benefits with pain relief and not having the nausea and some of the other side effects with the general anesthetic, but there are options. If you're getting a total knee done, we also do another special block that helps with pain afterwards, including your surgeon who might inject some medicine in there as well. You can get really good pain relief, up to a day of pain relief with just that and very minimal IV medicines or oral medications. So again, any questions that you may come up with, the provider will talk to you the morning of your surgery. You're welcome to ask them any questions about the anesthesia or what choice is best for you. So thank you for your time, and good luck with your joints, and hope you get feeling better.
So my name's Jessica, and I am here to talk to you a little bit about what you should expect once you get to your room where you're going to stay for the night. Some of the main goals that we'll be working with you on once you get up to your room is controlling your pain, getting you up and moving, and then some preventative measures to prevent complications such as blood clots and pneumonia and those types of things. So, pain. We know there will be pain. These types of surgeries are not a walk in the park, so there will be pain. And you'll hear a lot of people coming in and asking you to rate your pain on a scale from 1 to 10. There's no right or wrong answers. We use that scale just to kind of judge how you're doing, one, and then how the interventions that we're providing are doing to help control your pain. So it's a subjective thing. It is what you say it is, and we'll treat your pain based on that. What you can kind of expect the first morning after surgery, they'll be getting you up to your chair. The surgeon and probably the PA will be by to visit you. We'll be managing your pain with a combination of oral pain medications, ice, elevation. You'll have PT and OT this day. And you can plan to have your care coach present with you. That way there's a second set of eyes and ears there to kind of retain the information that there's going to be a lot of information. So most of you will go home after your second therapy session this day. Occasionally we have people stay longer, but you can expect to stay overnight, one night in the hospital. On that second day, you can expect to be out of bed again, up in your chair. You'll be getting bathed. You will get dressed in your own clothes, and therapy will work with you on just your basic cares so that you can go home and take care of these things on your own at home or with your care coach. Again, it would be nice to have your care coach there throughout the day to be there and gather that information to help you once you get home. Also want to talk to you about prevention of infection. Once you get home, some things to kind of watch for if you have increased swelling, redness at that incision site, if there's drainage of any kind, if there's a change in the drainage, or if you have a lot of increased pain right at that site or a fever of 101.5 or more, you definitely need to call the doctor. Those are all signs of infection getting to a point that it might need to be treated. So prevention for that, of course, always washing your hands, keeping that surgical site clean and dry. And another issue you might need to be aware of is if you have dental work following your joint replacement, you need to let your dentist know that you have had that joint replacement, and they will give you, likely give you a prescription for antibiotics as a preventative measure.
Hello, I'm Lane. I'm a respiratory therapist, and I'm here to talk to you about the importance of deep breathing. So taking deep breaths can help exercise your lungs and help prevent pneumonia while you're here in the hospital. You can think about it as breathing in through your nose and out through your mouth. Nice, long, deep breaths. To help you do that, we have what's called an incentive spirometer. We get a volume based on your height and your age. Gives us your lung volume. And what we'll have you do is take this mouthpiece, wrap your lips and teeth around it, and just take a nice big breath in, just kind of like I did. This is really just a visual aid for deep breathing. And we recommend that you do it 10 times every hour while you're here in the hospital and in bed.
Hi, my name's April. I work with physical therapy. I'm here to talk to you about all the things that you could do to not only help rehab your knee, but also prepare you to be safe at home with getting in and out of bed, helping prepare meals, and getting all the help that you need. Maybe we can think about those things before surgery. So some things that we can do to help make you a little safer at home include arranging to have your care coach present, arranging to have friends and family check in to make sure that you're safe, and if you can prepare some meals ahead of time, get the house cleaned up, laundry done, things like that, so that you're not having to do as much after your surgery when you're in pain. That's a great idea. If you can strategically place some chairs around the home so you're not walking long bouts without a good backup plan, it's a really good way for you to keep yourself safe at home. Please do not get on your hands and knees to do any tasks. It's dangerous if you've had a hip, and it's painful if you've had a knee. If you can lower your bed so your feet touch the floor but not lower, that's a great idea to keep you safe at home. There are some things that you can get at home that may help you. We'll try to broach those subjects when you're in the hospital with occupational therapy. These are things like a toilet riser, grab bars, a shower chair, a reacher, sock aid, shoe horn, and bath sponge are all things that we can arrange for you to pick up if you need them once you go home. That'll keep you safe. There are some things that you can do prior to coming that'll really help you. If you wanted to start maybe in the kitchen, you can put all the things that you need typically counter height, so you're not reaching down low or up high. If you don't have a good handrail on your stairs, it's wise to do that before you come in. 2 is better than 1, but at least 1 solid handrail to hold on to is very important. In your bathroom, if you can have handrails installed, your toilet riser is helpful. Make sure that any rugs that you have anywhere throughout the house are all pinned down so that you're safe and you're not tripping over those things and there are no cords in the way. All of those things are very important to help ensure that you're safe and you're not having to look at those obstacles after you go home. As far as physical therapy goes, we typically try to see you day of surgery or the day after. Sooner is better. We like to get you mobile. We don't have a lot of time, so the more you can hear what we have to say, the better options you have at home, and the better you have the opportunity to think of questions that you might have. Physical therapy will work with you for range of motion in your new joint. If you're a knee, we'll work with you on walking, how to get into your home if you have stairs. We'll work with you on self-care, and we'll work with you on how to teach you to get in bed, out of bed, and stand up safely. If you are having a hip procedure, you may have some hip precautions that we need to abide by. That makes things like getting your shoes on, bending over, and sitting in low chairs dangerous. We'll cover those with you. Not all patients will have hip precautions, so we'll make sure to cover that well if it's what you need to be safe at home. Some of our exercises, the most important one that I can always tell people is one of the easiest, and that's just really pumping your ankles all the way down and pick it all the way up like you're driving a car. This is important to make sure that you don't get blood clots after surgery, and it helps your swelling. So that one absolutely is crucial. We have exercises, quad squeezes, bottom squeezes, side slides. We'll kick your leg up. We'll fire all the muscles below the waist to make sure that you can get yourself in and out of bed, standing, walking, and get your range of motion back the way we need it to be so that you enjoy your new prosthetic, your new surgical leg. What did we have it replaced for if we weren't going to use it? An exercise that's very important for you to begin with immediately and practice at home is called an armchair push-up. So I would start by practicing kicking out your post-op leg. Do this in a chair with arms so that when you push up through those arms, you're getting all of that through your arms instead of using your legs. You can use your good leg to help push, but we need to get those arms firing so that we can get you standing and walking with your walker quickly after surgery. All of those exercises are in your booklet. They're also on the Recovery Coach website. If you have any questions, the written information is there, as well as some other exercises that will help you with your strength and range of motion.
Hello, I'm Angela Schrock. I'm one of the pharmacists here at the hospital. I've been here over 20 years, and I'm going to talk to you about your managing your pain and your medicines after your knee or hip surgery. Pain control during and after the surgery is one of the main concerns, or one of the most common concerns of joint replacement. Usually you'll work with your doctor to choose the right method that based upon your medical history and the amount of pain you're having and your phase of recovery. It's important that you are part of the team, the pain management team for you, that you express to the nursing staff any kind of nausea you're having, any pain that's not being covered, or if you're feeling as if you're getting too much pain medicine and maybe a little tired or drowsy. They can always make adjustments in your pain medicine. Pain is a cycle. It begins and increases until you get the medication to stop it or interrupt it. The whole point of pain control is to try to avoid getting to that point where the pain is intolerable. It's important also to request pain medicine probably 30 or 45 minutes prior to exercise session so that you can achieve your goals more readily. Some of the narcotic pain medications I want to talk about would be Norco, and Norco is hydrocodone and Tylenol together, Percocet, which is oxycodone and acetaminophen together, and Ultram. It's important that you follow your directions as the doctor's prescribed them to you. If you're having to take 2 pain medications, you need to wait 6 hours before you take your next dose. Always remember to take your pain medicine prior to physical therapy because you'll get more out of your physical therapy. It's important to try not to become addicted to the medications, so we want you to try to taper down. That first week, by the end of the first week, you should try to not take it more than 3 times in a day, usually before physical therapy, like when you're sleeping, and also when once throughout the day when you feel severe pain. By the 3rd week, you want to try to get it tapered down to taking it just twice a day. And the whole goal is to try to have yourself weaned off your narcotic pain medication by 6 weeks. At that point in time, usually they'll consider giving you anti-inflammatory medications and ice to help curb your pain. The anti-inflammatory medications are to reduce your narcotic usage, also as well as ice. So stop taking narcotics when they are not needed. Some of the anti-inflammatory medications they may be using on you, and you need to consult with your doctor because some surgeries they want you to wait to a certain point before they'll let you take it, or they don't want you to take it at all because it may inhibit bone healing. Ibuprofen or Motrin is an anti-inflammatory. Advil, Aleve. Celebrex is one of the medications that Dr. Larimore will sometimes prescribe after surgery. It's important that you don't take all 3 of those together. They're kind of in the same class of medications. Now, Tylenol is another pain medication that you can take pretty much after the day of surgery, but you have to remember that acetaminophen or Tylenol is also in Norco or Percocet. So you try not to take more than 4 grams or 4,000 milligrams of Tylenol in a day. Some other methods to decrease pain are frequent position changes, ice on a regular basis. Also, trying to keep yourself busy and your mind distracted is another good way to avoid or to help with the pain. Preventing a blood clot is another important issue after surgery. You'll be usually taking aspirin 325 milligrams daily, or if you're already on anticoagulants, and you'll need to talk to your doctor. They may have give you advice or instructions on what to do. Some bleeding while brushing your teeth will be normal. Do your foot pumps. Get walking as your ability increases. Some important things and side effects to watch for when taking any kind of anticoagulation, aspirin included in that. Watch for shortness of breath or trouble breathing. It could be a pulmonary embolism. Also, watch for swelling or pain in your calves. It could mean you could be developing a DVT or deep vein thrombosis. Pulmonary embolism is a blood clot in the lungs, and it's a life-threatening situation. If you're having sudden chest pains, difficulty in breathing and rapid breathing, shortness of breath, sweating, confusion, it's important that you call a doctor, call right away 911. What a pulmonary embolism is it as when a blood clot actually breaks away and goes to your lungs, so you're not getting oxygen. Bleeding or falling after surgery, call your surgeon if you're bleeding or if you fall after surgery. If you have any of these symptoms, please call your surgeon and get guidance from him. Bleeding or oozing from the surgical wound, nosebleeds, specifically nosebleeds that last past 5 minutes, blood in your urine, coughing or vomiting blood, excessive bleeding when brushing your teeth. If you have a lot of spontaneous bruising, dizziness, numbness or tingling, rapid or unusual heartbeat. If you're having chest pain or shortness of breath, increased swelling or tightness or pain in your calf, vomiting, nausea, fever, or confusion. Constipation is another possible side effect after surgery. You've just had knee or hip surgery, and so you're not moving around as much, as well as some of the narcotic and the pain medicine can cause you to be constipated. So it's important that you're moving when you should be, drinking plenty of fluids and water, high fiber in your diet, continue your physical therapy, wean your narcotic pain off, and some options for constipation are things like milk of magnesia, Miralax, Senecot S, Colace is another one, or docusate sodium.
Hello, I'm Tiffany Heck. I'm one of the clinical dietitians here, and today I'm just going to be talking to you a little bit about nutrition and how that can help with pre-surgery and recovering from your surgery, so that it hopefully speeds up the process and just makes it a smoother process for you. So if your surgery is at least 2 weeks from now, some of these things you can begin making these changes now, or you can do it even if your surgery is a few days from now. It's never too late. But some of the first things we'll talk about is iron, vitamin C, and calcium. So iron is needed to build healthy red blood cells. There may be some potential blood loss during your surgery, and so you want to build up those red blood cells in preparation for that. And some foods that are going to be high in iron, you have a list in your packet, but just some examples, anything like beef, spinach, beans, even potato, those are some examples of high iron foods. And then vitamin C, it makes it easier for the iron to get into the body. And so that's going to allow the iron to work more efficiently and increase your iron supply as well. So your foods that are going to be high in vitamin C, you probably know a lot of those. A lot of your fruits and vegetables, even bell peppers, oranges, a lot of your citrus fruits are going to be good sources of vitamin C. And then calcium is important for building new bone and maintaining existing bone strength. So of course a lot of your calcium foods are going to be your dairy foods, anything like milk, cheese, yogurt, actually even almonds has good calcium in it, broccoli as well for some non-dairy foods. And so calcium is another really important nutrient. With alcohol, you want to avoid alcohol, especially in the 48 hours prior to surgery. For water, try and make sure that you're staying well hydrated. So the recommendation is to try to get 8-ounce glasses of water in one day. Protein is the next thing we'll talk about. So protein is necessary for maintaining muscle mass, regaining strength, and rebuilding those healthy tissues. The recommendation is to have between 1.25 and 1.5 grams per kilogram per day of protein. So you can calculate that with your body weight. There will be a dietitian that sees you, most likely myself. We will see you post-op day 1, so the day following your surgery. You will be on the joint camp diet, but typically right after surgery they start you on clear liquids. That's just to make sure you're not going to have any nausea, vomiting with the anesthesia. Once you tolerate the clear liquids, they'll go ahead and advance you to the joint camp diet, which is basically just a regular diet unless you are diabetic. But on the joint camp you can have pretty much anything. You will automatically receive either one Ensure and Live or one Ensure High Protein per day while you're here in the hospital. The Ensure High Protein is going to be for the diabetic patients. It's going to be lower carbohydrate and lower sugar. And then the Ensure and Live is for anybody else. But those are good protein shakes that just provide a lot of good protein, about 20 grams per bottle. Also has a lot of good vitamins and minerals in it as well. Like pharmacy said, pain medications can cause constipation, and so eating a diet high in fiber can help prevent that constipation. So your whole grains, your fruits and vegetables, those are good sources of fiber. A lot of people find that they experience a poor appetite after surgery, and so if you can kind of just have lighter foods around, eating smaller amounts like snack-sized meals, people find that that can be helpful rather than just eating 3 large meals a day. Some examples of foods that might taste better right after surgery, things like Jell-O, broth, maybe some vegetable beef soup. You could have yogurt on hand. You could have some of those Ensure protein shakes on hand as well. But just easy things that you can be eating as you recover from surgery. And so if you have any questions, we'll be seeing you in the hospital and we can talk to you more then.
My name is Carolyn Maxwell. I'm an RN case manager here at the Hutchinson Regional. I make rounds every morning with Dr. Larimore and several of the orthopedics and help plan your discharge plans. We have several options that you might consider. One, you can go home and have a family member help with your care. And in that case, we would try to line up a walker. So if you have a walker that you can borrow from a family member, or you can borrow one from the orthopedics physical therapy area. Secondly, if that's not something that you're going to be able to do following surgery, we can set up inpatient rehab, which is here in our hospital, or we can set up a time for you to spend at a skilled nursing facility until you get strong enough to go home. Dr. Larimore is very good about putting a shower-proof, waterproof dressing on so that you'd be able to take a shower after you get home, but if you need a chair to go in your shower, that would be great too. To have those things set up before you come in would be the best, to have a walker, shower chair, anything like that. The next thing we do is we work with insurance. Some insurances allow total knees and hips to be inpatient, and Medicare no longer allows total knees and hips to be inpatient from the get-go. If one night stay is doable for you, we tend to send people home the next day now. Doctor would like you to have all of your physical therapies on that second day and go home after you watch a video where he gives more instructions on going home. If that is not possible and you're not doing well with therapy, we can keep you a second night, but plan to go home mostly anymore the next day. Another thing we can do is if you need advanced directive information, we can give that to you. Our social workers work very close with all your physical therapy needs if the doctor decides they want physical therapy after your discharge. So I hope to see you, and good luck in your stay.
All right, well, that concludes the pre-op ortho class information. You've heard a lot of wonderful things, some great tips on how to prepare for surgery and what to expect. Just know that you have a binder that has all of that information in there, so you do not have to memorize everything that you heard. You have all that there. We also encourage you to enroll in the Recovery Coach program. That also is a way to have the same information in an electronic format. So there's plenty of opportunity to remember and go through the information you just heard again. As always, if you have any questions whatsoever, you can contact your surgeon's office, or if you need to contact someone at the hospital, you certainly can do that as well. We'll be here with you. We'll see you post-op, and we'll also be able to talk to you before you leave to go home.